What's up, everyone? Dr. Jacob Wilson here. Today's topic of the day is going to be green tea for losing fat, right? So if you haven't come to the channel before, make sure that you like the video, subscribe. It would be an absolute pleasure to talk to you every single day about gaining muscle, losing fat, the latest ingredients that actually will optimize your journey to health, right, and your performance goals in the gym. So again, today we're going to talk about green tea. Now, green tea is a very interesting topic, right? The thing about green tea is, what's so special about it? Well, first off, it contains a special nutrient or nutraceutical in there that we call EGCG, okay, or epigallocatechin 3 gallate, okay. So basically, this ingredient that's in there, okay, EGCG, is a potent, what we call thermogenic. Okay, so what's a thermogenic? Thermogenic is something that raises our metabolism. So studies show, for example, that supplementing with green tea, whether in pill form or actually drinking it, seems to on average raise our metabolism about 3 to 4% on a daily basis, okay? Which actually could turn out to be quite a bit of calories when you think about factoring an entire year, okay? So studies show that basically over about 12, 15 week period of time, that people who supplement with green tea, who are trying to lose weight, versus a placebo, actually lose about 1.5 kilograms or close to 3.5 pounds of fat more than the people who did it. Now, I don't know about you, but like over a 12-week period of time, that's a great success. It's a great outcome. And there's meta-analyses on this. There's lots of studies on this. Green tea just seems to work very well. Now, when we look at green tea, the thing to understand is that studies will show that like 1 to 2 cups of green tea a day produce all those effects. What does that typically have? Well, 1 cup of green tea has about 125 to 150 milligrams of that EGCG, okay? Now, and that seems to work very well. So basically people, when they have 2 cups of green tea a day, are having about 250 to 300 milligrams. And every cup of green tea also has about 50 milligrams of caffeine. Not a lot, but a little bit, right? So when you look, say you're going to supplement with green tea, what you're going to look on the back of the label is that EGCG, and you want to make sure it has at least 150 to 250 milligrams. Now, going above that doesn't seem to help with fat loss much more, okay? Now, what I would recommend is taking it like pre-workout. If you're not working out, take it in the morning to program your metabolism. Okay, and it does seem, some people say, should I get decaf green tea or green tea? Well, listen, 50 milligrams of green tea is probably not going to make you lose fat, but when combined with green tea, it actually does have a positive effect. So decaf green tea doesn't have as much of an effect on its own. And that's because caffeine and green tea work what we call synergistically. They're better together. That's why 50 milligrams of caffeine can be effective with green tea than they are apart. It's why green tea is not as good without caffeine. So what happens is green tea and caffeine work by enhancing our adrenaline, okay? So what happens is when we exercise, adrenaline goes up. Green tea stops the adrenaline from being broken down. And when adrenaline binds to its receptor to cause us to lose fat, basically what happens is adrenaline binds the receptor. It signals a bunch of molecules to say, hey, lose fat. And caffeine basically stops those messengers from being broke down. So that's why they work synergistically. So again, to summarize this up, green tea can certainly help you lose fat. I'd recommend either having 1 to 2 cups a day of green tea, or if you purchase a supplement, make sure you get about 150 to 250 milligrams a day of EGCG. I would recommend probably cycling it. So maybe have it 4 to 5 days a week, 2 days off. You can go 2 days on, 1 day off, 3 days on, 1 day off, however you like to do it. Always cycle your thermogenics so your body doesn't get used to them. After a month, probably come off it for a week and then repeat. Thank you so much, guys. I'll see you next time.